Now, after that, on the tutorial, after you have seen the tutorial of antibiotic therapy, we now continue with the next very important aspect of the management of these patients. You need to know that after evaluating it, you need to know how to initiate the feeding of these patients. Is it clear? You need to know that in patients that have severe acute malnutrition, we said that the problem was that these patients are going to have fluid retention. So, and they are going to be apathic. The problems were that they were apathic, they will lack energy, they are going to have fluid retention. So, in order for you to initiate feeding in such children, you are going to give a product that is going to make them less apathic or emotionful. Ezekiel is going to make them to have emotion. It's going to make them increase their appetite. You give a product that is going to make them increase their appetite. You give a product that contains less salt because they have salt retention. You give a product that contains some proteins that is going to result to what? That's going to result to the reduction of the edema or the fluid retention. You give a product that is going to increase their energy. It's going to contain high calorie to increase their energy. Basically, and the best product that has all these features is F75. Basically, so you give F75 to these children. Basically, and when you give F75 to these children, the dosage of F75 is 135 mils per kilogram, 130 mils per kilogram per day. Basically, and then you give it every 3 to 4 hours. That is only what the child is going to eat. Basically, the child only eats it. Apart from anything, the child eats nothing else. He only eats this. Basically. So that is what you're going to consider provided. Now, for children, this is F75 that to be used as from children that are more than 6 months. Is it clear? But if a child is less than 6 months, is it clear? F75 is going to be used for children that are more than 6 months to 1 year. Is it clear? Provided the child is between 6 months to 1 year, you can also use artificial milk like formula feeding. Is it clear? That to help them in addition to the F75. If the children are just less than 6 months, it is exclusive breastfeeding. Is it clear? Exclusive breastfeeding. So those are the different elements that you have to evaluate. So generally, I just made a small mistake. We consider malnutrition when a child is more than 1 year. So F75 is given when you are more than 1 year. Is it clear? If the child is less than 6 months, you give exclusive breastfeeding. And if the child is between 6 months to 1 year, it is both exclusive breastfeeding. It's both breastfeeding plus formula milk, plus you have to give him the appropriate food for that time. Is it clear? So those are the different things that you have to evaluate in this way. So it's breastfeeding, and then you add also formula milk. Is it clear? And other formulations between 6 months or 1 year. So those are the different elements that you have to evaluate. Now, after that, you have given, normally F75 is given for 3 to 5 days. Is it clear? And after the 3 to 5 days, the loss of the child should have already increased appetite. It should be more emotionful and joyful. It should have the reduction of edema and should have more energy. And when there are those features of increase, and when there are those features have disappeared, now we can now pass to the other food, which are the other food, the secondary food to give to the child. You give now F100, and F100 is given at a dosage of 150 mils to 200 mils per kilogram per day. Is it clear? Still in 3 divided doses. Or you give plum peanuts. Is it clear? It's either you give F75 or you give F100 or you give plum peanuts. Is it clear? Now, you need to know that what if a child has acute malnutrition, severe acute malnutrition, it's always good to start with F75 because it's going to help to make this characteristic first come back. But if a child has chronic malnutrition, you can directly start from F75 and plum peanut, and it can be managed outpatient. I hope you understand it. So those are the different elements. Now, the next element on our table was that you should move now to you should give, since there is low level of protein, you should give now the next one, which is F100. For low energy, you first give F75. For low level of protein, give F100, or you give Plumpy Nuts. And now the next thing is, if the child is still apathic, you have to contact back the child to the society. So the management here is reconnect the child to the society. Is it clear? So you have to bring the child to you have to make the child have fun. You have to do everything for the child to reconnect back to the society. It's also another management protocol on the WHO. And then the last one is to become back as other children. You have to bring the child to social services. Particularly, you can bring them into pre-nursery school for the child to play with the other children. You can, so those are social services to become like other children. You can bring the child to the pre-nursery school so that he can play, he can have fun, and for him to gain back that other social contact like the other children. Is it clear? So that is how you manage malnutrition. After the management of malnutrition, we now move to the complete the follow-up of malnutrition.